One reason I do what I do is because I'm out. You know, this is what I do. I'm an activist. So it's.
We're here today on the PHCC West Campus trying to bring awareness to HIV and AIDS. We have Reverend Joe Paramore here with us today, who is an HIV/AIDS activist and advocate.
So, how long have you had the disease, and what brought about you getting tested?
In 1992, I had shingles 3 times in 3 months. Like many young folks at the time, I was obviously in denial. The ironic thing is I was actually working in the field of HIV and AIDS. And for a number of years I led that life of denial. In 2000, I became sick and was taken to the hospital and was diagnosed with PCP, which is pneumocystis carinii pneumonia, which then led to testing to confirm and verify. And I've been on meds since 2000.
When you were first diagnosed, what were some signs and symptoms that you had?
Well, the shingles, first of all, in 1992, which, if we would have paid attention to that and not lived in denial, it would have saved a lot of heartache. The biggest symptoms in 2000 was fatigue, shortness of breath, to the point of gasping for air, and which is what led to the hospital visit. And once the tests were done and confirmatory tests were done, I was there with a viral load of 1 million plus and a CD4 count or T cell count of 17.
How do you manage the cost of the medication and treatment that you're receiving now?
Well, that's, you know, I am proud to serve on the West Central Florida Ryan White Care Council. In the early days, I was a recipient of assistance from Ryan White, which is a wonderful organization that assists folks that are positive and that have an AIDS diagnosis that needs assistance with primary care treatment. And Ryan White is a place and a way to help offset that cost and to ensure that everyone that has a diagnosis gets appropriate and adequate treatment.
Have you ever attended a support group, or are you actively attending a support group for HIV or AIDS?
I do not actively attend a support group now. There are community-based support groups available through community-based organizations. There are faith-based organizations and within the community of faith that offer support groups for HIV positive folk. There's, you know, several groups that are called Positive Living that offer support groups. And I always encourage someone that is newly diagnosed or newly tested positive. If you don't have a strong connection with your family, you don't have a strong support network, get involved in a support group because you're going to need it. I mean, it's a life-changing experience because at the stage we're in now with this disease, you will have it for the rest of your life. And it's nothing to be ashamed of. You know, I think the word AIDS and HIV creates more of the drama and the stigma around it than it being looked at as an STI.
You know, since we're here on this campus with all of these young students, if you were talking to them, what is the one thing that you would like to tell them?
Know your status. Get tested. we ask ourselves the question, then what can we do in terms of preventing it? You know, it's not as stigmatized as it was in the early days. And the treatment and the care that's available now is far different from when we first started dealing with this in the early 80s. Know your status, get tested, and stay protected.
All right. Well, thank you very much for speaking with us
My
today.
pleasure.